So disease surveillance is also very, very important. It is critical that every member of the animal care team realize their important role in disease surveillance. And probably the most important people are the kennel staff. And we recommend having a written checklist that's on the cage for every day. They can be quite small cage cards where they just check off, is there eating, drinking, diarrhea, what's their behavior. And that's something then that the veterinarian can review when they come around on daily rounds. We strongly encourage shelters to establish a system in which their veterinarian participates in daily rounds. This does take a lot of expensive veterinarian time, but it is so worth it. And the daily rounds is constructed in a way that we expect the veterinarian to lay their eyes on every single animal in the shelter, hopefully every day. That's why we call it daily rounds. It doesn't have to take a really long time because a checklist of further actions is being created. So they don't actually deal with issues that are identified right now, but they make a list and they're assigned and somebody's accountable for carrying them out. But it prevents the problem of animals being kind of lost in the system forever. And so daily rounds, we have a little form and we ask, who are you in that cage? How are you? Are you doing well? Are you where you should be in the system? Do you need something to be done for you today? And what else can we do to help you either improve your quality of life in the shelter or just move on? If you don't have a veterinarian, or you don't have a veterinarian every day who can do daily rounds, you can train qualified technicians to do this, but training is the key here. It's not something just to throw to a staff member and hope that they work it out. They need to be able to recognize signs of common diseases and stress in the shelter. They need to have a veterinarian to go to when they identify these problems, because they will. And then there's a daily rounds action list of items that are identified during daily rounds that need to be delegated to somebody. And it's very important that this be a written document and that we know who it's being delegated to and that there's accountability and written record keeping of what's been done.